let's talk about eyebrows. Hi everybody, welcome back to Face It with Dr. G. I'm Dr. G. We're going to talk about eyebrows today. We all have eyebrows, don't we? And eyebrows are very expressive. They're arguably one of the most expressive features of our upper face or entire face. Do you think your eyebrows, if you're a female, are the same as a male's and vice versa? No, they're a little bit different, actually a lot different. The basic structure of the eyebrow is in the lower third of the forehead. They are composed of 200 to 250 coarse short hairs that are without the erector pili muscle. So a lot of the hairs on our bodies have erector pili that allow the hairs to stand up when you're cold. The eyebrow hairs don't have these muscles. This is kind of interesting. The other thing about eyebrow hair is that the life cycle and the growth is relatively consistent through the span of your life, with the exception that older men can typically have accelerated growth of their eyebrow hair. And I'm sure we've all seen a family member or a friend that has those crazy eyebrows and you want to cut them off. We pay a lot of attention to our eyebrows. We get them waxed, we tweeze them. They're a focal point of our face, and they tell a story. For me, as an aesthetic provider and a dermatopathologist, my patients talk to me with their eyebrows. I see what they've been through. I see what they use them for. Do they scowl a lot? Do they raise their eyebrows up? What do they look like? A female eyebrow typically is raised laterally, okay? The eyebrow is positioned on the supraorbital rim. You can feel it, the bone on the top of the eye or the orbit. And it's raised laterally in the lateral third of the eyebrow. As we age, the eyebrow of the female and the male, but we'll talk about the female first, is depressed. And it's depressed because the muscle around the eye pulls the eyebrow down. And it pulls the eyebrow down laterally. And then our muscles in between the eyebrows and a little bit above the eyebrow pull the medial eyebrow down. So as we age, we lose height of our eyebrow. We also lose integrity of the skin, which is supporting the eyebrow. And we also lose bony support of the orbit. So all three of those combined cause sinking and depression. So what can we do to elevate? So we'll talk about that. Let's talk about the man eyebrow next. So the gentleman's eyebrow is a little bit lower. It's flatter. It's thicker. And it's right at or slightly below the orbital rim. Now, depending on your goals, your aesthetic goals, some men like to have a little bit of a raised eyebrow. But in general, the male's eyebrow is lower, less arched laterally, thicker, coarser, and more masculine. An eyebrow, if you took a photo of just eyebrows and tried to choose feminine versus masculine, sometimes it may be easy and sometimes it may be hard because it really depends on what your overall goals are. In general, when it comes to rejuvenating the upper face, there's a bunch of different injectables we can use, including neurotoxins like Botox and Dysport, as well as derma fillers. And the goal is to maintain eyebrow position. There's a trend recently where we're getting spiky eyebrows and they're going way up and this huge arch thing. I don't necessarily think that's beautiful. I think we need to maintain and prevent the falling and the droopiness and the sagging versus elevating too much. This is my own approach, but what do you think? What do you think of your eyebrows? I hope this helped. Now you're gonna go around analyzing everybody's eyebrows. Let me know what you think. And subscribe, like, comment, let me know what else you wanna hear about, and I'll talk to you guys soon.